Our pre-video questions. The way to know my cholesterol levels is by a blood test. True or false? High cholesterol has no symptoms. True or false? A complication of having high cholesterol is a stroke or heart attack. True or false? Cholesterol. My name is Nathan Kakish, the Medical Director of Cultivating Health Ministries, and we are going to discuss cholesterol for a few minutes today. Some statistics about cholesterol. There are 93 million people in the United States who have total cholesterol levels above 200, and that includes 7% of children and adolescents who have high cholesterol. And unfortunately, high cholesterol does not cause any symptoms until an event occurs. The complications of high cholesterol include heart disease, strokes, heart attacks, occlusion in blood vessels to the legs, and patients with high cholesterol are more prone to other chronic diseases. Cholesterol is a naturally occurring fatty substance present in all cells of the human body, necessary for the normal functioning of the body. Most of the cholesterol is produced in the liver, although it is also obtained through some foods. Your body makes enough cholesterol for its function. Cholesterol in the body does get used for making hormones and other chemicals that are necessary for proper cell function. There are two main primary types of cholesterol: your bad cholesterol, your LDL, and your good cholesterol, your healthy HDL or high density lipoprotein. The LDL has traditionally been associated with cholesterol deposits in the blood vessels that cause heart attacks and strokes, while the high density lipoprotein, or the HDL, considered the good cholesterol, tends to help take away cholesterol and bring it back to the liver, thus having a beneficial effect on lowering the amount of bad cholesterol deposits. There are several factors that come in play when we talk about our cholesterol. There are factors that we can control and risk factors that we cannot control. So that with factors that we cannot control include our genetics, if we are genetically predisposed to having high cholesterol. Our age tends to raise our cholesterol levels. Our gender, males tend to have higher levels, especially compared to females prior to menopause. And certain diseases such as thyroid disorders may cause some elevation in cholesterol levels. Those are non-modifiable risk factors that we cannot control. The factors that we can control include our nutrition, making healthy, better food choices to help lower our cholesterol. Our weight is a risk factor that we can control by increasing physical activity and reducing oral intake. Exercise and taking medications to help our cholesterol is another option that we have that is modifiable or is under our control. The appropriate levels for cholesterol have changed over the years, and prior years we used to discuss total cholesterol levels. A level less than 200 is technically considered desirable. A level of total cholesterol between 200 and 239 is borderline, and above 240 is considered high. We currently focus more on the LDL levels and not so much on the total cholesterol. So if your LDL level, or the bad cholesterol, is less than 100, that is considered optimal. A range between 100 and 129 is considered suboptimal, above normal. A level between 130 to 159 is considered borderline high, and levels above 160 traditionally have required treatment because they are considered high. These levels vary depending on your risk factors. The higher risk you are for heart attacks and strokes, the lower your optimal level is set. These numbers and this graphic are traditionally for healthy patients who do not have any underlying chronic medical conditions. HDL, the high density lipoprotein, or what you can call healthy, if that helps you remember what HDL is, a level less than 40 tends to be considered low and raises your risk for cardiovascular disease. Remember, the healthy or high density lipoprotein helps lower the deposits in the arteries. A level between 40 and 59 is considered adequately high, and anything above 60 is considered protective and great value for patients that have that. The third component of a lipid panel are things called triglycerides. Triglycerides is another form of a fatty substance that occurs in the blood. The normal range for most patients is below 150. Borderline ranges can range up to 200, and anything between 200 and 500 is considered high. Triglycerides are not as associated with cardiovascular disease as LDL is. However, in certain high-risk populations, a triglyceride level above 200 may warrant treatment with certain medications that do lower them. And unfortunately, the medications that lower LDL don't often lower triglycerides substantially. Cholesterol deposits are illustrated in this diagram here. You have an open patent artery with good blood flow through. And on the right, you see an artery with a large lipid deposit or plaque that is there from cholesterol depositing, causing narrowing of that blood vessel, thus reducing the blood flow. Complications of high cholesterol include heart disease, primarily, blockages in the heart arteries that cause a heart attack, and blockages in the brain arteries that precipitate a stroke. You can also develop diabetes and other chronic medical conditions, pancreatitis from very high triglycerides, especially at 500 plus levels, and significant circulatory disease, blockages in arteries in the brain, the eyes, the legs, and the internal arteries can cause blockages to other organs that cause complications. Hypercholesterolemia, or high cholesterol, does not present symptoms or physical signs, so its diagnosis can only be made through a blood test that determines the levels of cholesterol and triglycerides in your blood. This blood test is best done if you are fasting for approximately 8 to 10 hours, but if you are not and can only do a test non-fasting, that is also useful. And it is strongly recommended that anybody at risk of suffering from dyslipidemia or alterations in the normal levels of cholesterol or fats in their blood, especially those with relatives who have ischemic heart disease and other cardiovascular diseases, that they undergo lipid testing from an early age. There are recommendations to test children as young as 11, and there are recommendations to test young adults periodically, depending on their levels and their family history. Thank you for your attention. Remember, it is important that you speak with your healthcare provider, nutritionist, and pharmacist to help optimize your treatment and management. And we do ask that you complete the final survey on this video to help us know if this knowledge was useful. Post-video questions. The way to know my cholesterol levels is by a blood test. True or false? Cholesterol or high cholesterol has no symptoms. True or false? A complication of having high cholesterol is a stroke or a heart attack. True or false?